The topic we now consider is behavior therapy. And I'd like to say right off that behavior therapy is not as narrow as it was 20, 30 years ago when I initially wrote about this theory in the mid-70s. We had no idea that this particular approach would branch out as it has. And of all the therapies, behavior therapy is one of the most evolving approaches. So appreciate that behavior therapy today is very different than behavior therapy of yesterday. In fact, there are frequently considered three waves of behavior therapy: the classical behavior therapy, and then the social learning cognitive second wave, and then the third wave called the acceptance and mindfulness-based approaches, which I'll talk about here. The one thing about behavior therapy is that we need to see that there are some defining characteristics of this approach. One is that everything is empirically based. This is an approach that's the closest to scientific findings and incorporating scientific research into the practice of therapy. And a defining characteristic of behavior therapy is that it begins with assessment. A behavior therapist will always start with wanting to assess where the client is right now, where the client was, so we have some interest in the history of the problem, and then where the client would like to move toward. So assessment is the beginning part of this particular approach to therapy. And after assessment, and these things don't operate in this rigid fashion, lockstep fashion, but the therapist and the client together formulate precise treatment goals. That's a defining characteristic of behavior therapy. We don't operate with fuzzy, general, global goals. Behavior therapists really want to anchor down what are the specific goals. So that's a defining characteristic of this. And I want to add this, that goals are generally not just established by the therapist alone, but in collaboration with the client. That's a very important point. So it's a partnership. The client determines what will be changed. So sometimes the goals are established by the therapist or by the institution and the agency. But generally, the client and the therapist together agree upon goals that are workable. And if you go way back to the Adlerian approach, Adlerians stress what they call goal alignment. In other words, Adlerians don't decide for clients what the goals will be, but they are very concerned about aligning goals together. The therapist and the client mutually agree on what will we be doing in here. So you can again see the Adlerian approach has influence in contemporary behavior therapy, that behavior therapists say to have effective therapy, you need to have a client that has a stake in the goals. Thirdly, a treatment plan is formulated, and it's rather systematic, and that's a defining characteristic of behavior therapy. The behavior therapist is supposed to be the expert on helping the client figure out how to change. You see, the client says, here's what I would like to change. The therapist says, okay, have some ideas about that. So a treatment plan is formulated. So we go from assessment to identifying precise, specific, concrete goals that are very operationally defined, to treatment plan, and this last part, part 4, or the fourth characteristic, objective evaluation. behavior therapists don't just guess that therapy is working. They hold themselves accountable. Accountability is a part and parcel of this approach. The therapist has to demonstrate, indeed, that the treatment plan is working. And there are empirical ways of validating how well the treatment is happening. And if the treatment isn't exactly the way it should be going, then they can modify techniques. See, so behavior therapists work in concert with the client to adjust the treatment techniques, the strategies that are used. But the key piece here is objective evaluation. It's not just done on clinical hunches. The therapist doesn't just say, well, I kind of think we're making progress here. The therapist has to demonstrate, indeed, if they're working with, let's say, depression in clients or reducing phobia, something specific like that, the therapist has to demonstrate, indeed, that a technique is addressing depression or phobia reduction. This is where evidence-based practice comes into play. Behavior therapy, more than most approaches, stress using evidence-based practice and strategies and techniques that have some kind of empirical support. And so for certain kind of problems, like substance abuse or, let's say, eating disorders, depression, anxiety, social phobia, fear of flying, you can name a whole array of problems. There's an impressive list of techniques and strategies that have empirical backing, research support to show that some techniques are superior than others. So that's a very defining characteristic. So a strength of this approach is that there are many techniques that are behavioral in nature that can be called upon to help clients. I'll just mention a few. Like one is relaxation approaches. And you can really use many of these behavioral techniques in many of the other therapies that we've talked about or will talk about. So relaxation training. Some behavior therapists teach their clients how to relax, how to breathe, and then to practice that at home like 25 to 45 minutes a day. So relaxation training and relaxation methods can be used alone, but it can be used in conjunction with other specific techniques like systematic desensitization or helping clients get actual practice in real life situations called in vivo desensitization. So if a client has a fear of riding in an elevator, in vivo exposure means maybe the therapist even takes the client to a mall where there's an elevator or an escalator and goes on the elevator or the escalator with the client who fears those means of getting from one floor to the next. But they expose the client behaviorally to the very thing that brings about anxiety. Another approach that's behavioral is called social skills learning. And social skills learning is quite popular for people who, let's say, lack social graces or who have difficulty in going to events because they kind of feel awkward. They don't know how to be with people. So social skills training is actually a psychoeducational approach. By the way, behavioral approaches believe that therapy is education. So the role of the therapist in a behavior therapy modality is to be an educator, to teach, and they actually coach. So if you're a behavior therapist, you'll teach, you'll coach your clients specific skills that they can use not only in the office, but how they can use that at school, at work, at home. Another area that I want to mention is multimodal therapy by Arnold Lazarus. That approach is really a multiple approach to assessment, the basic id model that Lazarus talks about. He talks about really a holistic approach to working with people. Is you work with their biology, their interpersonal relationships, their sensations, their thoughts, their imagery, their emotions, what kind of medications they take. So the basic id model is a way of looking at holistically, making an assessment. And then Lazarus would say the techniques that you develop really can be drawn from many, many different approaches to help clients make the changes they desire. Last area that I want to talk about with behavior therapy are the approaches called mindfulness and acceptance-based cognitive behavior therapies. Why I'm mentioning this is because this is the new wave, and a lot of people would think, is this behavior therapy? I mean, you're talking about stuff that seems way out here. And one approach is called dialectical behavior therapy. Marsha Linehan is the particular prominent person who developed this. In 1993, wrote a couple of books on this, and it's primarily used for the treatment of individuals with borderline personality disorder. And really, dialectical behavior therapy, or DBT, is an interesting blend of psychoanalytic concepts and behaviorism and Eastern approaches and the Buddhist traditions and meditation. And Linehan studied with people. One was a Zen master because she wanted to figure out other ways of working with patient populations. So it's a very interesting blend of behavioral techniques, but intermixed and integrated with some Eastern approaches. This approach, DBT it's called, works a lot with one mindfulness. In other words, doing one thing at a time. Another approach is called MBSR, or mindfulness-based stress reduction. John Kabat-Zinn was a pioneer on this, primarily working with people for pain management and stress, and people with cardiac disease, heart problems and whatnot. He developed a whole program in the East, and he found ways to teach people mindfulness and ways to reduce stress by doing things such as yoga, deep breathing, meditation, and mindfulness. I know this is short shrift, but at least know that's one approach to behavior therapy. And then there's Siegel and colleagues' approach called mindfulness-based cognitive therapy, and that's primarily for the treatment of depression. But again, we're integrating cognitive approaches with mindfulness approaches. And lastly, and this is very big today in behavior therapy, is ACT, acceptance and commitment therapy. Hayes and his colleagues have done a lot of work in this area. And by the way, all of these approaches that I just mentioned, ACT too, are empirically based and have a lot of research support. So these are not approaches that are just fringe, that are interesting kind of waves. They do have support of research. And basically, acceptance approach says most of us have difficulty in non-judgmentally observing. Most of us want to continually critique what we see and what we hear. And this approach is saying, learn to accept what is. So don't try to make reality happen, accept it. And if we can accept the reality that we're trying to fight, we become a lot more less stressful and less stressed out. So this approach, ACT, is saying acceptance and commitment therapy. By the way, it's not enough just to accept non-judgmentally life, but it's important to make a commitment to what can I do in my everyday life to bring about the kind of change that I want. And the basic kind of change in life is, what do I want to do to have a purposeful, meaningful life? ACT talks about a purpose and meaningful life and existence. So you can see that these newer approaches to behavior therapy have a lot in common with some of the existential and even the Adlerian approaches and the person-centered Gestalt approaches. So a lot of these approaches are now beginning to converge, and there's a basis for integration.